Welcome guys to today's class. In today's video, we want to discuss this topic, sterile pharmaceutical preparation. Sterile pharmaceutical preparation. Yes, we have a lot of things we will learn from this topic. Yes. That is to tell us that pharmaceutical preparation can broadly be divided into two: sterile pharmaceutical preparations and non-sterile pharmaceutical preparations. Yes. What do we mean by sterile pharmaceutical preparations? It simply means that a pharmaceutical preparation is said to be sterile pharmaceutical preparation if it meets these three conditions. If it meets these three conditions: one, it must be isotonic; two, free from particulate matter; and three, free from pathogenic organism. Once a particular pharmaceutical preparation succeeded to meet up with these three conditions, it is called sterile pharmaceutical preparations. Sterile pharmaceutical preparations. Yes. That means if a particular pharmaceutical preparation did not succeed to meet up with these three conditions, it is called non-sterile pharmaceutical preparations. If you want to understand examples of non-sterile pharmaceutical preparation, you can talk about tablets, capsules, syrups, suspensions. These pharmaceutical preparations just mentioned, they do not meet up with these three conditions mentioned here. Yes, they don't meet up with these three conditions mentioned here. Yes, take for instance, these tablets, syrups, suspensions, there are minimum level of what? Some microorganism. I take it again. There are minimum level of some microorganisms that it can tolerate or we can allow it to have. Yes, because they do not get to your bloodstream directly. Yes, when you take any of the non-sterile pharmaceutical preparation like syrups, suspension, or all these other products, tablets, syrups, suspension, capsules, when you take it into your system, they don't go to your bloodstream immediately. They undergo a lot of what? Processes called ladme. We'll still discuss that when we discuss pharmacokinetics and pharmacodynamics of drugs. I think we have posted that one on the YouTube. Yes, we have posted it. You can type Chidon's Daniel pharmacokinetics of drugs and you see what we discuss about that and the calculations under that. But what we are focusing on today is to tell you that any of these non-sterile pharmaceutical preparation just mentioned, that they are called non-sterile pharmaceutical preparations because they do not succeed to meet up with these three conditions. There are minimum level of some microorganism we can allow it to have because they are not entering to your bloodstream directly. No, they are to pass through a lot of processes, get to your liver and also have you before getting to your what? Bloodstream. And by so doing, by passing through these processes, all those organisms that it has will be taken care of through those processes. You get it? But in today's class, we want to focus on these sterile pharmaceutical preparations. Yes, we said it must meet up these three conditions: must be isotonic, free from particulate matter, and free from pathogenic organisms. Can we mention some of their examples? Number one, infusions. Normal saline, desosaline, Lingas latate, all of them, you notice that it is being given by IV. Yes. So it's going straight to your what? Bloodstream. It must meet up these three conditions. We will still discuss why is it important that it must meet up these conditions. Also, more examples are all these eye drops. It must meet up these conditions, otherwise it will cause problem to the lacrimal flows, yes, in the lacrimal glands. And so let's see why it is important that these sterile pharmaceutical preparations must meet up these three conditions. For the first one, isotonic. Isotonic. We'll be discussing so many things here. There is what we call hypertonic, hypertonic, then isotonic, and what? Hypotonic. From our knowledge of biology, these three things we are discussed there, yes. Now, hypertonic solutions. We say hypertonic solutions are those solutions whose concentration is higher than that of the cell. Once a sterile pharmaceutical preparation is hypertonic, it will cause what we call plasmolysis. Once this sterile preparation is no longer isotonic but hypertonic, it will cause plasmolysis. That means the shrinking and shriveling of the cell membrane due to excessive what? Loss of fluids to its surrounding. You want to understand what we mean by plasmolysis? Just get a pinch of salt, that normal salt you use to cook at home. Sprinkle it on earthworm. You see how it will shrink and shrivel the earthworm like dry meat. I get what I'm saying. That means if someone make mistake and give a patient a hypertonic solution, so to speak, what it will cause is shrinking and shriveling of that cell membrane of that person, so that that patient will have serious complication. Take for instance, you take eye drop that is hypertonic or that is not meant to be hypertonic. You take a particular eye drop that is not meant to be hypertonic, that must be isotonic, because we say eye drops must be sterile preparations, and you give it to the patient, it will dry up the person lacrimal fluids and the person will have serious issue. It can cause to blindness, so to speak. And so every sterile pharmaceutical preparations are meant to be what? Isotonic. If it is hypotonic, what will it cause? Bursting of that cell membrane of that organism. It will cause bursting of the cells. You now see that it will look as if you that way that you soak something inside water, let's say beans inside water, it will swell up and burst. Bursting of that cell is what will take place, and that is another serious complications we can have from that. And that is why we say it must be what? Isotonic. It must be free from particulate matter. Imagine the eye drop they are giving to you contains sand. You know what used to happen to us when sand enter our eye? That person will start doing as if he's blind. You can imagine. And that is why it must be free from particulate matter. Whatsoever particulate matter, so to speak, it must be free from it. Free from pathogenic organisms. Yes. Because the organism will attack the cell if it is not free from it. Yes. And that is why we say sterile pharmaceutical preparation must succeed to what? To meet up these three conditions just mentioned. Now, in this video, we want to concentrate on this isotonic solution, and that is why we have some of the questions here that we want to discuss that will help us to appreciate this topic. In next subsequent videos, we will discuss more about this because this is a broad topic, so to speak. Now, as we all said, isotonic solution is a solution whose concentration is same with that of the cell, and so they will be compatible. Yeah, there will be high compatibility between high isotonic solution and the concentration of the cell. You get it now? Now, it is important for you to know that for you to prepare a particular pharmaceutical product, a particular sterile pharmaceutical product, and you want to make it to be isotonic, there are many methods one can use to make that preparation to be isotonic. Yes. Number one is what we call freezing point depression method. Freezing point depression method, which we call cryoscopic method. Cryoscopic method. Then the next one, or the next method, is what we call sodium chloride equivalent method. Sodium chloride equivalent what? Method. Yes. And the number three is White Vincent method. But in this video, we will be discussing sodium chloride equivalent method, so to speak. That is what we'll be discussing in this video. How to use sodium chloride equivalent method. Then in subsequent videos, we will also discuss how to use freezing point depression method to what? To sort it out. Now, to use sodium chloride equivalent method to solve or to make a particular sterile pharmaceutical preparation to be isotonic, it's important for you to note that every powder, every solution, every powder, so to speak, has its sodium chloride content of it. It has a amount of sodium chloride that it contains. Take for instance, if we talk about let's say paracetamol, that is a popular drug we have. Now, paracetamol powder has its what? Content of what? It has a level of what? Sodium chloride content in it. Like if you have 1 gram of paracetamol now, paracetamol powder, if you check official book, they might tell you that inside this 1 gram of what? Paracetamol powder you are seeing, that it has maybe 0.05 gram of sodium chloride. This as an example, is example, so to speak. Not that. Now, in this video, we want to discuss sodium chloride equivalent method. Use of sodium chloride equivalent method to make a sterile pharmaceutical preparation to be isotonic. Yes. Where is this concept, sodium chloride equivalent method, where is it coming from? It's coming from the concept that says that every powder, every pharmaceutical powder has a quantity of sodium chloride content in it. What do I mean? Let's say now ephedrine sulfate. Ephedrine sulfate, if you have 1 gram of ephedrine sulfate, look at what they wrote here. It means that 1 gram of ephedrine sulfate will be having what? 0.23 gram of what? Sodium chloride. Every pharmaceutical powder have a particular amount of sodium chloride it contains. Yes. That means if you talk about paracetamol, you have to check our farm codes, our official codes, like British Pharmacopoeia, European, American Pharmacopoeia. You have to check it to know what is the what sodium chloride content or equivalent in 1 gram of what? Paracetamol. If you get 1 gram of paracetamol, the implication is how much sodium chloride does it contain. When you hear something like this means sodium chloride equivalent of ephedrine sulfate is 0.23. Like if you get 1 gram of ephedrine sulfate, that is the interpretation now. You get 1 gram of ephedrine sulfate, it means that it contains 0.23 gram of sodium chloride. If you get 1 gram of dextrose, it means that it contains 0.16 gram of what? Sodium chloride. That is, every powder, pharmaceutical powder, so to speak, has amount of sodium chloride it contains. That is where it's coming from. That means we will have to have it in mind that if you are using 1 gram of, let's say, ephedrine sulfate, you have to note that 1 gram of ephedrine already have 0.23 gram of sodium chloride. So that if you are adding extra sodium chloride to it to make it isotonic, you have to be careful with the quantity you are adding so that it will not be hypertonic or hypotonic. Yes, so that it will not be too much or not up to the isotonic quantity needed. You get the gist? Okay. So what we are trying to say here is that since we are using sodium chloride equivalent method, or we are discussing sodium chloride equivalent method now, it is important to know that our fluids, our blood fluids, like blood plasma, our blood fluids, it contains 0.9% what? Weight per volume of sodium chloride. The sodium chloride content of our what? Blood is 0.9% weight per volume sodium chloride. Do not forget that your blood plasma contains 154 milliequivalents of what? Cations and 154 milliequivalents of anions. Our blood plasma contains 154 milliequivalents of what? Cations and 154 milliequivalents of what? Anions. Now, that's your blood, so to speak, which we must make it to be isotonic. Anything coming to your blood must be isotonic because the fluids in your blood is 0.9% weight per volume of sodium chloride. That it doesn't pass 0.9%. Yes, it does not pass 0.9 what percent. If it pass 0.9%, that means it is hypertonic. Wahala results. Are you getting it? But you need to also be careful when they use calculation to what? Confuse you in this topic. Oh. You need to be very careful. Watch what I mean. You know that this 0.9% weight per volume sodium chloride you are seeing simply mean 0.9 gram in what? 100 what mil. 0.9 gram of what? Sodium what? Chloride in what? 100 mil. That is what it means. That means if I divide this by 2, I must divide this by 2 to remain isotonic. If I divide this by 2, you have 0.45 gram sodium chloride in what? 50 what mil. Like you make it up to 50 mil with water. Like watch what we mean, no, to avoid mistake. To avoid you making mistake, look at your test tube. What I mean by 0.9 gram in 100 mil is that you get your sodium chloride, measure out weigh out 0.9 gram of it. Look at your sodium chloride now. As I weigh out 0.9 gram of it, I will use water to make it up to what? 100 mil. That is what we mean by 0.9 gram. It doesn't mean you put salt, you now go measure out 100 ml of water and pour. No. If you measure out 100 ml of water and now pour inside here, it will be 100 and something ml. So it's not how we do it. How we do it is you put your salt, you now use water to make it up to 100 ml mark. Then you have gotten an isotonic what? Solution, so to speak. Then, if you are using 0.45 gram, you must make it to 50 ml. You must make it to what? 50 ml. In fact, let me use pharmaceutical. Add up to 50 ml. Add up to 50 ml. Are you getting it? Of water. Then, if I multiply this by 2, I'll be having 1.8 gram of sodium chloride. Add up to what? I will multiply this by 2 to be 200 what? Ml of what? Water. So these are the concepts you need to understand, that all this, depending on the quantity you want to prepare, there are ways of making a particular solution to be isotonic. Like if you want to get isotonic water, if you want to make a water isotonic, you say 0.9 gram in what? Make it to 100 ml. 0.45 gram of salt, make it to 50 ml of water. That is just it. Are you getting it? Now that water must be a sterile water, so to speak. Okay. Now, as I'm seeing this and as I've interpreted this, that is to tell us that if I'm using sodium chloride equivalent method, I must achieve this rule that says I must make it to be 0.9 gram in 100 ml or 0.9% or any of these as the case may be. If I want to make up a particular solution to be isotonic, I must either make up this or this, whichever one, depending on the quantity of salt you have and the volume you are asked to prepare. If you are asked to prepare a bigger isotonic solution, okay, I can be multiply. If I multiply by 3, I multiply it by 3, by 4, by 4, by 5, depending on the quantity. I don't know if you are getting the point. Okay. Now, try to sort out this. Watch the logic we use to solve it. Now, the question number 1 says a solution contains 1 gram of ephedrine sulfate. A solution contains 1 gram of ephedrine in a volume of 100 ml. What quantity of sodium chloride must be added to make the solution isotonic? I will tell them, for a solution to be isotonic, it must have 0.9 gram of sodium chloride. Any solution that is isotonic must have 0.9 gram of sodium chloride. If I'm using 0.9 gram, I will show that I'm to add it up to what? 100 ml. That is one. But if I use 0.45, 50 ml, 1.8, 200 ml, and so on, as I illustrated here. Now, the implication is that this 1 gram of ephedrine is also 100 ml. So this one 100 ml, this one 100 ml, making our work to be easier. Now, next thing I will do is that I will tell them that from what they said here, they are saying that 1 gram of what? Ephedrine sulfate contains what? Contains 0.23 gram of what? Sodium chloride. So if 1 gram of this contains 0.23 gram of sodium chloride, how many gram was given to us here? They say 1 gram. That means, look at this, 0.9 gram is in 100 ml. What they are trying to tell you is that if you have this to be your ephedrine sulfate powder, look at your powder, ephedrine sulfate, that is 1 gram. This 1 gram contains 0.23 what? Gram of what? Gram of sodium chloride. That 1 gram you are seeing here of ephedrine sulfate, it contains 0.23 gram of sodium chloride. And if truly that it contains 0.23 gram of, you are not meant to cram this, so you are not meant to cram this. We have what we call pharmacopoeias or pharmcodes, USP, British, European, there are many. Are you getting it? You just bring that book, that pharmcodes, and search ephedrine sulfate, and you now see where they write is sodium chloride equivalent, and you bring it out. You are not meant to cram it. Where will you start to cram from? How many drugs are you to cram? Are you getting it? So you are not meant to cram it. So in case of you, if you are already wondering, should I cram all this thing? No, you are not to cram it. But you must know the techniques that are to be followed to answer this question. Now, this 1 gram of sodium ephedrine sulfate contains 0.23 gram of this. And it is made to what? 100 ml. Yes, in a volume of 100 ml. It is made to 100 ml. Now watch, this 0.9 gram of sodium chloride is also in 100 ml to be isotonic. That means for a drug like ephedrine sulfate to be isotonic, I will now tell them that this 0.9 gram needed to be in 100 ml. But here we are having 0.23 gram. I have to say 0.9 minus 0.23. That will be giving me what? 0.67 what? Gram of what? Sodium chloride. That means I have to go to sodium chloride and weigh out 0.67 gram of it and put it inside this ephedrine this. In that case, that ephedrine what? Sulfate is isotonic because 0.67 plus 0.23, 0.67 of extra sodium chloride added plus 0.23 of sodium chloride in ephedrine will be giving you 0.9, and all of them is inside 100 ml. With this, you are done. So it means if they ask you what quantity of sodium chloride must be added to make the solution isotonic, you say it is 0.67 gram of sodium chloride, and that is just that. Now, how much dextrose will be required for this purpose? Now, it is important to note that there are what we call isotonic adjusters. We have many isotonic adjusters. Yes. Number one, boric acid. Number two, potassium nitrate. Number three, dextrose solution. That means if in your lab or in your pharmacy that you do not have sodium chloride, or they tell you that sodium chloride powder has finished, it's no longer, it's out of stock. Yes, all you could do, you go and lay hand on dextrose or on boric acid or on potassium nitrate, whichever one you have, and use it to do your calculation. Now, if I'm laying hand on dextrose, I must still have it in mind that I must check what is the sodium chloride equivalent of dextrose. Sodium chloride equivalent of dextrose is this. That is from Pharmcodex, or from our pharmacopoeias we have. It is a book. Every pharmacist must have it. Yes, you use it for, it's like our dictionary, so to speak. So what I will now do is that as I've answered this question, I will now tell them that since that from my calculation that I realized that it is 0.67 gram of sodium chloride that is needed for this ephedrine, that is needed for this 1 gram of ephedrine sulfate in 100 ml to be isotonic. I will now tell them that, okay, from sodium chloride content of dextrose, we have that 1 gram of dextrose is equals to 0.6 gram of what? Sodium chloride. So 1 gram of dextrose contains 0.16 gram of sodium chloride. That is what this means. The same way we say 1 gram of this contains this of sodium chloride. Are you getting it? Then what am I checking now? This sodium chloride that I need to make this to be isotonic, that is this quantity. 0.67 gram of what? Sodium chloride will give you how much quantity of dextrose? I will now use my calculator. I will say 0.67 divided by 0.16, and that will be giving us 0.67 divided by 0.16. That will be giving us 4.1875 gram of what? Dextrose. That means I will approximate it to 4.2 gram of dextrose. That means if I do not have sodium chloride to weigh out 0.67 gram of it to put here to make it isotonic, I should go and weigh 4.2 gram of dextrose. When I weigh 4.2 gram of dextrose, I put it here. When I put it here, it has taken care of this solution, like it has made it to be isotonic. The same way, if you carry this and put here, it will make it to be isotonic. That means if you carry this 0.67 gram of sodium chloride and put it here, this isotonic, because this plus this is 0.9 that we are looking at to make it 100 ml. Then if you carry 4.2 gram of dextrose and put it here, it is what? Isotonic, because 4.2 gram is equivalent to what? It's equivalent to 0.67 gram of sodium chloride. Do you get it? Now to answer question number 3, a solution contains 1 gram of ephedrine sulfate in a volume of 30 ml. What quantity of sodium chloride must be added to make the solution isotonic? So to make it to be isotonic, watch what we do. Remember that for a solution to be isotonic, it will have 0.9% what? Sodium chloride. Where per volume sodium chloride, right? Okay. Now watch what you do here. You now say that this means 0.9 gram is in 100 ml. It must be in 100 ml to be what? Isotonic, as we said. Now, this one is 1 gram in what? 30 ml. For the ephedrine sulfate given to us, they say 1 gram of what? Ephedrine sulfate is what? 30 ml. And we are looking at it to be in 100 ml. We say in 100 ml, what will it give us? 100 times divided by 30. 100 divided by 30. 3.3 gram of what? E-sulfate. That means I have succeeded to make this 1 gram of this in 30 ml given to us to be in what? 100 ml. That is rule number 1. You must make it to be in 100 ml. Now, as it is in 100 ml now, and they say this of ephedrine sulfate is this, okay? I will now tell them that since 1 gram of what? Ephedrine sulfate contains what? Contains 0.23 gram of what? Sodium chloride. Are you getting it? That means, what about this? 3.3 gram of what? Ephedrine sulfate. How many sodium chloride will it contain? Contains 3.3 times 0.23. 3.3 times 0.23. That will be 3.3 times 0.23. That will be 0.759. 0.759 what? Gram of what? Sodium chloride. That means that as I weigh 3.3 gram of ephedrine sulfate, if I weigh 3.3 gram, this is 3.3 gram of ephedrine sulfate. You can see it now. This is 3.3 gram of it. Then I make it up to 100 what? Ml. Inside 3.3 gram of ephedrine sulfate, how many of sodium chloride does it contain? Approximately 0.76 gram of what? Sodium chloride. So this 3.3 gram of ephedrine sulfate contains 0.76 gram of sodium chloride. But this is not the amount of sodium chloride that your preparation, which is in 100 ml, should have to be isotonic. This is what it must have, 0.9 gram. So that means that I will subtract 0.9 and 0.76. Therefore, 0.9 minus 0.76, what will it give me? 0.9 minus 0.76. That will be giving me 0.14 equals to 0.14 gram of sodium chloride. That is to tell you that the new quantity or extra sodium chloride that you have to weigh out to put it inside here, inside this 100 ml ephedrine sulfate, is 0.14. So what do? You now say that when I weigh 3.3 gram of ephedrine sulfate, I put it inside my container. Then that ephedrine sulfate contains 0.76 gram of what? Sodium chloride already. So what I will now do is that as I use water to make it to 100 ml, I put 0.14 gram of a fresh sodium chloride. I put it inside here. Yes, once I put it inside here, that's 0.14 and 0.76. That is what will make it to 0.9, and it is in 100 ml. That means that ephedrine sulfate here, it is now isotonic. Are you getting it? Now, in case that they did not give you what? Sodium chloride, or you don't have sodium chloride in your what? Pharmacy, but you have dextrose, and you want to know the equivalent of dextrose that is equivalent to 0.14. All you just need to do is that you say 1 gram of what? Dextrose contains how many sodium chloride? They say 0.16. Then 0.14 gram of sodium chloride which you need it but you do not have it in your pharmacy, all you do is you cross multiply to get your answer. 0.14 divided by 0.16, and that will be giving you 0.875. 0.875 gram of what? Dextrose. That means when you weigh 3.3 gram of ethylene sulfate, put it inside this container, you can weigh 0.14 gram of sodium chloride to make it here, or to add it up here to make it isotonic. Or you can weigh 0.875 gram of dextrose and put it here. Instead of putting the sodium chloride, you put dextrose, this quantity, inside here, inside this ethylene sulfate with 3.3 to make it to isotonic. Remember the concept or the reason why this question was asked. This is in 30 ml, and the rule says that if you are using sodium chloride equivalent method, this 30 ml that it is made it up to should be what? Should be in 100 ml. That is why we converted first to 100 ml and get 3.3. Then before we now what? Relate it to what we have. Then succeeded to see that we have this content of sodium chloride in 3.3 gram of ethylene sulfate, and which needs 0.14 gram of new or fresh sodium chloride to make it to be isotonic, or which needs 0.87 gram of dextrose to make it to be what? Isotonic. All of them will be make up to 100 ml. If you are putting this here, you make it up to 100 ml. If you are putting this dextrose here, you make it up to 100 ml. That is when you will get it to be correct. But if they give you any other thing like boric acid, they will give you its sodium chloride equivalent, and so you follow the same procedure. 1 gram of boric acid contains also sodium chloride. This sodium chloride will contain how many boric acid? You use it. If they give you potassium nitrate, you also do like that. You get it. Okay, thanks for watching the video. See you in our next class.